Am I audible and visible? Let me know. Let me confirm, then we'll start. Am I audible and visible? Am I audible? I think audio is. Am I audible and visible? Okay, fine. Hello everyone, welcome to Unacademy Future Doctors. Myself Dr. Dipti Karia. I'm MD PhD Physiology and I'm your faculty for Physiology. Okay. Now, so let me explain in brief about our subscription. Here, NEET PG, some announcements, important announcements are also there. We have All India mock test. Okay, All India mock test. Just a minute. We have this. Sorry, sir. Just a minute. There is some issues regarding. So, NEET PG All India mock test is there. That is scheduled on just a. So, this is on February 26th at 9 a.m. and you have final chance before the final exam to compete and test your preparation. So, you can enroll now for the same. NEET PG 2022 All India mock test. It has pattern and questions. They are similar to main exams. Analytics to showcase valuable insights, solutions, and options for concepts and clinical learning. Video solutions also is given. So please enroll for the same if you are NEET PG aspirant. Also, we will provide you NEET PG notes, comprehensive notes for the next, curated from the live classes of Unacademy. Well structured and high yield exam targeted notes will be provided that helps in effective revision, complement the video lectures for respective subjects, as well as crisp important topic focused based on the latest exam pattern that is given. So stay tuned with us. Also, we have our crack NEET PG with combat that is scheduled on February 19, that is at 6 p.m. And the subjects are orthopedics, obs and gynae, surgery, and pediatrics. So you can enroll now. Top rankers can win exciting rewards, and 10 lucky participants can win amazing gift vouchers too. Now let me explain about our subscription. We have two kinds of subscriptions. One is plus subscription. Here you can choose the best from the best. You can access both live as well as recorded classes, learn from India's top educators for your medical exams. You can compete in the live test and quizzes. You can study on the device of your choice. You can access question bank, which is having more than 25,000 high yield questions. Second is our iconic subscription. Here, your access to the best from two of the best, and they are Unacademy and Prep Ladder with Unacademy. All the features I explained, and second, that is Unacademy and Prep Ladder with Prep Ladder. Here, you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags, and more, rapid revision and snapshots and treasures in 2021 Dream Notes. These are our FMG December 2021 toppers. Also, we have certain series, as you can see here, educated curated test series for medicine that is scheduled on February 16, February 18. We have ANC test series, combat obs gynae surgery pediatrics that is on February 19, February 23. These are all the different test series. You can see surgery, biochemistry, okay. All India mock test that is on 26th Feb. Okay, so this way you can prepare yourself for NEET PG. Okay. Also, we have added certain features in special class. We made the class interactive and live. You can have facility of raise a hand, poll for the learner is facility is also available. You can never miss a class. You can get lecture notes and you can attend the class at anywhere and at any time. Also, we have NEET PG 2022 All Educator Revision Batch that is for 3 months and target NEET next 2023 subject-wise batch that will be starting from February 19 for for 1 year. So those who are in the internship, those who have started internship, for them this is very much beneficial. Focus FMG 2022 comprehensive batch, that is for 9 months, started. It has been started from February 19 to October. It will be starting from February 19 to October 22. And Focus FMG 2022 comprehensive batch, that is for 4 months. Another very important announcement is you can get a chance to subscribe with 20% off. This offer was till February 16. Now it is extended till February 19. So you can see here you have this much of saving on each and every subscriptions, plus as well as iconic subscriptions. Okay. So instead of 10%, if you use my code DIPTI10, you will get 20% off. So please grab this opportunity and you can get 20% double discount. Okay. This I have already discussed. This also I have already discussed. All educated revision batch, NEET PG 2022 ultra fast revision batch. Previous year question batch also we have started for 15 days, and image based question batch, that is for 15 days. Focus FMG comprehensive batch for 9 months as well as for 4 months also we have started. Okay, so these are our subscriptions plus as well as iconic. And as I told you, if you use my code, instead of 10%, you will get 20% off till February 19. Okay, so you can subscribe from your mobile, either plus or iconic subscription. Use my code DIPTI10 and you will get 20% off. Okay, now this also I have already discussed. 26 Feb is our all India mock test. Okay, now there is also one more option on our app, that is you can join a quiz. Okay, so how to join a quiz, I'll just explain you. You can see here, you can take a quick quiz option and then join quiz, and you enter this code. I have created a quiz for membrane potential today, and the code is 906436. So note down the code. If you enter this code, you can have a quiz of 10 questions. Okay, so this way you can join a quiz. Okay, now this also I have already discussed. You can buy 3 month subscription and get 1 month subscription free. Okay, now we'll continue. We will start with our objective learning. Today's learning objective, that is cardiac arrhythmia and ECG changes. So clinical aspects of ECG. I told you, all of you, those who were present on my special class, I told you that please attend live classes also. We will discuss certain important aspects, clinical aspects of ECG here today. Today's topic is one of the very important, not only for physiology, for also medicine and your NEET PG also. This is very important topic. Certain arrhythmias are there, which are the ECG changes we will discuss. Okay. Now, let us start with cardiac arrhythmia. The name itself suggests, you can see, arrhythmia means disturbance in normal rhythm. Okay, when normal rhythm is disturbed, disturbance in normal rhythm. Okay, normal rhythm is sinus rhythm. Sinus rhythm means it is generated from SA node. Okay, and the rate is 60 to 100 beats per minute. This is normal sinus rhythm. Okay, now this cardiac arrhythmia. What is cardiac arrhythmia? That may be due to abnormal rhythm. The sinus rhythm gets abnormal. That is one cause. Okay. Second cause is defect in the conduction, block of the conduction. That is also known as heart block. And third, that is ectopic cardiac rhythm. Ectopic means some other focus is there which starts generating impulse. Okay. So there's three ways there is disturbance in the normal rhythm. I repeat, cardiac arrhythmia means disturbance in the rhythm. Now, this rhythm disturbances are either because of, if there is abnormality here in the SA node, if there is blockage of the conduction, that is second cause. This is first cause. And third cause is some ectopic, ectopic means not the normal one. Some other, you can say that some other tissue or some other part of the heart started generating impulse. So that is ectopic cardiac rhythm. We will discuss one by one, starting with the abnormal sinus rhythm. So abnormal sinus rhythm, that is either sinus arrhythmia. We will discuss all this in abnormal sinus rhythm. Sinus arrhythmia, sinus tachycardia, sinus bradycardia, sixth sinus syndrome. Conduction blocks or conduction disturbances, they are SA nodal block, AV nodal block, bundle branch block, ectopic cardiac rhythm, that is atrial arrhythmia and ventricular arrhythmia. We will discuss all this one by one. Okay. Now, starting with first, sinus arrhythmia. What is this? Sinus arrhythmia. Here, what happens? Rhythm is normal sinus rhythm means it is generated. Sinus rhythm means it is generated from SA node. Okay, sinus rhythm is there here. Okay, but this is disturbed, so it is known as arrhythmia. Means duration between RR wave, RR interval is not equal. So you can say that it is arrhythmia. You can see here, this is one and other R wave. You can see here 1, 2, 3, 4 squares are there. Here you can see between two R wave, less number of squares are there. Okay, so these are disturbed. This is arrhythmia. RR interval is not equal. Okay, now very important thing here, commonly it is with respiration this happens. Sinus arrhythmia commonly present with respiration. What happens here? With inspiration, if you are inspiring, heart rate increases and expiration heart rate decreases. This is known as sinus arrhythmia. Why? Because of change in the vagal tone. Okay, and this vagal tone, it affects your SA node and this heart rate is affected. So this is sinus arrhythmia. Okay, so with inspiration you can say that vagal tone decreases, with expiration vagal tone increases, so heart rate decreases. And it is common in children and athletes. Okay, because they have good vagal tone. Okay, now, next is sinus tachycardia. Here tachy, very important word. Tachy means normal. First of all we will discuss normal heart rate. That is, your normal heart rate is 60 to 100 beats per minute. This is normal heart rate. Okay, this one. Now, tachycardia and bradycardia, try to remember when the pulse rate or heart rate is more than 100 per minute. This is tachycardia. Okay, always important thing, when the word is sinus means it is originated from SA node. So it is sinus. So it is starting from the SA node. Okay, normal sinus rhythm, but the rate is greater than 100 beats per minute. Okay, you can see here. Normally, I will explain you. Normally, between 2R wave, normally there are, I'll just show you, around 3 to 3, or you can say 3 big square, or you can say 3 5s are 15 small squares. Here you can see only 10 small squares are there. Now, one more thing I would like to explain you here, how to calculate heart rate. This is very important thing from ECG. How to calculate heart rate? Easily, I will show you. What you have to do is, suppose you can find this is 10 small square between two R wave. Okay, so what you have to do is you have to write down 1500 divided by 10. What is your heart rate? 150 beats per minute. How this 1500 comes, I will discuss. Okay, now, so 1500, why? As we have discussed, speed of the ECG paper is 25 millimeter per second. Means in 1 second, 25 small squares are there. Okay, and when we are talking about heart rate, we have rate means per minute means 60 seconds. So in 60 seconds, how many small squares are there? 25 into 60 is equal to 1500 small square. Okay. So now you can say that, You can see here. Now, how can we calculate? How can we get this formula? In 10 small square, we have 1 heartbeat. Okay. So in 1500 small square, how many heartbeats are there? So you can come to know that 1500 multiplied by 1 divided by 10. This has come now. Am I clear? So this is your heart rate, 150 per minute. So this way you can calculate heart rate from ECG. Okay. Now, so sinus tachycardia means impulse generated from SA node. Okay. But the rate is higher than, very important thing to remember here. What is normal rate? Just to remember, normal rate is 60 to 100 beats per minute. Okay. When it is more than 100, that is tachycardia. Causes are physiological and pathological. Physiological causes of tachycardia is during exercise. Okay, we have increased heart rate. And pathological causes are fever. Okay, because with increased temperature, heart rate increases. Anemia, because what happens? Because of anemia, viscosity of blood decreases. And as viscosity of blood decreases, what happens? Flow rate increases and heart rate also increases. And second thing is, because of anemia, less amount of oxygen is given to the tissue. So to provide more oxygen, cardiovascular centers are stimulated in medulla and they increase heart rate. So these are two causes in anemia. Okay. Then hyperthyroidism, metabolism increases. Okay. And reflex response to decreased blood pressure. When blood pressure decreases, heart rate increases. This is a reflex response. Okay. So this way. Next is sinus bradycardia. Okay, the name itself suggests. Very important thing here again is brady means less. Normal heart rate, as we have discussed, 60 to 100 beats per minute. When it is less than 60 beats per minute, that is bradycardia. And why sinus? Because it is originated from your SA node. Now you please calculate heart rate from this one. You can see here. How many small squares are there? 1, 2, 3, 4, 5, 6 big squares. 6 fives are 30 small squares are there. So how much is the heart rate? 1500 divided by 30. I told you how this has come. Why 1500? As I told you, in 30 small squares, one cardiac cycle, then 1500 small square. Why 1500? Because 25 millimeter per second. 1 second, 25 small square, 60 seconds, how many? So 1500 small square, how many cardiac cycles are there? So your heart rate has become 50, you can see. So that is sinus bradycardia. Okay. Now, what are the physiological causes for sinus bradycardia? Mostly it is physiological. Pathological in case of heart failure. It is seen in athletes because they have very good vagal tone. Vagal tone is high. Okay. Vagal tone is high. So, there is a sinus bradycardia. Next very important thing is sixth sinus syndrome. Sixth sinus syndrome, here what happens? The person is having bradycardia. Okay, decrease heart rate. Okay, dizziness, not feeling comfortable, dizziness, and syncopal attack. Syncope means loss of consciousness for a few seconds. Okay, and so these are the characteristics: bradycardia, dizziness, and syncope. These three are there in sixth sinus syndrome. Now, why there is sixth sinus syndrome? What happens here? Okay, here, I think all of you are knowing carotid sinus and aortic arch are the baroreceptor. Carotid sinus, you can see here in the this arch of aorta, we have aortic arch baroreceptor, and in common carotid artery, we have carotid sinus receptor here. So this carotid sinus receptors, these are baroreceptors. These baroreceptors are they become sensitive to pressure. Hmm? So when pressure increases, increase in the pressure, this because slight increase in the pressure also stimulates this carotid sinus, baroid sinus. So what happens? They are stimulated and they cause fall in the heart rate, bradycardia. Hello, S. Verma. Good evening, beta. Welcome to my class. So that produces decrease in the heart rate. Okay. Now treatment is most of the time artificial pacemaker is placed. Okay. Artificial pacemaker is placed. Pacemaker for this clinical condition. Okay. Now, uh, next very important arrhythmia, that is because of heart block. Okay. Now, what is this heart block? Heart block means when impulses, you can see here, they are generated from SA node, but the conduction, this conduction is blocked. Okay. Now, very important thing, this block is either at the SA node. This is one of the very important question, will be asked either in physiology, in your university exam. Okay. Need PG also from this, because this is clinical aspect also, you will find patients having heart block and conduction block. Okay. And in medicine also this is important. We will discuss very important topic. Okay. Now, so either there is block here as a node, second block in the AV node here, or in the bundle branches. So this all three kinds of blocks, they have different clinical pictures. Okay. Starting with first SA nodal block, you can see here blockage of impulse from SA node to the atria. Okay, so they will not depolarize atrial muscles also here. Okay, so what happens here? You will be having loss of the heartbeat. You can see there is no heartbeat here. Loss of whole heartbeat. This is also known as sinus arrest. Here it is written. Okay, and after an interval of about 2 cardiac cycles, okay, because there is new pacemaker, instead of, if SA node is not performing, new pacemaker that starts the rhythm. So you will be having new pacemaker that starts the rhythm, and your ECG starts showing waves. Okay, so this is SA nodal block. Okay, then this normally also sometimes you can see here SA node is getting blocked. So now you can see AV node has started the function. So you can see P wave is not very clear here. You can see here, and you have QRS because the impulse started from ventricle. Okay, and the rate you can see it is of AV nodal 40 to 60 instead of 60 to 100 per minute. That is SA nodal rhythm. Okay, now, so this may occur in elder individuals sometimes, elderly individuals and the patients recovering from coronary artery occlusion. Okay, in them this is found. Okay, and it is manifested as sick sinus syndrome we have discussed. Okay, and you can see characteristic, as I told you, P wave is not found, and ventricles they start rhythm, so you have only QRS complex followed by T. Okay, so this is SA nodal block. Second thing is AV nodal block, which is most common one. Here what happens? There is block in the AV node. Function of AV node is conduction of impulse. Conduction of impulse from atria to ventricle. This is the function, atria to ventricle. This is the function of AV node. Okay. So if this is getting blocked, AV node, so what happens? These impulses are not conducted. Okay. Now what are the causes? If there is ischemia of AV node, okay, or bundle of AV node, compression here, or inflammation here, or sometimes vagus nerve where it is stimulated excessively, that blocks the, because vagus stimulation results in stimulation of blockage, AV conduction block. So that is found. Okay, so these are the causes for AV nodal block. Now There are two types of AV nodal block. One, you can see incomplete heart block. Okay, means you can see this is first and second degree. You can see here, this is prolonged PR interval. Okay, you can see here, first or second degree. Okay, but P wave is followed by QRS here. But in complete heart block, third degree, okay, you can see that P wave is not followed by QRS. You can see two P waves followed by QRS. We will discuss in detail complete and incomplete heart blocks. Okay, now starting with first degree heart block or AV nodal block, you can see here. Okay, what is the pathology here? There is partial, you can write down along with me also, there is partial disturbance of conduction between atria and ventricle. Partial disturbance of conduction between atria and ventricle. Okay, and that results because of decreased conduction, all atrial impulses will not reach to ventricle. Okay, so you can say that PR interval is prolonged. You can see prolonged PR interval. You can see here, this is PR interval. Normal. Hello, beta Sanjay. Hello, good evening. So normal PR interval we have discussed 0.12 to 0.16 second. When it is more than 0.2 seconds, that is prolonged. So here this is more than 0.21. 0.2 seconds means one small square is equal to 0.04. So it is more than 5 small square. You can see here. Okay. Very important thing is always P wave is followed by QRS. So you can say because this is partial block, slight block. So it requires more time, but the impulse will pass from SA node to AV node. So the rate is 1:1. Means one atrial impulse produces one ventricular conduction. Okay, now, so this is first degree, mild block. Next is second degree heart block. You can see here. What happens here? The block is sufficient. So what happens sometimes? You can see here 2:1 block. 2:1 you can see, or 3:2 or 4:2 also. Means you can see here 2 P wave you can see followed by QRS. This is 2:1. If 3 P waves followed by QRS, 3:1. So some of the impulses from atria cannot pass to ventricle. Means suppose atria generates two impulses from which only one passes to ventricle. So you will find two P wave, one QRS. Okay. Same way 3:1. Okay. Now, so there are other forms of second degree heart blocks, and they are, number one is Van-Quebec phenomena. This is first diagram, Van-Quebec phenomena. Here, what happens, this is also known as Mobitz type 1 block. Here, what happens, there is gradual lengthening of PR interval. You can see here, this is the PR interval. This is the PR interval here. This is the PR interval here. And followed by one dropped beat. Okay, I clear? Then cycle repeats. Then again gradually PR interval increases, then followed by drop beat. Okay, so this is Van-Quebec phenomena. Second is Mobitz type 2 block. This is periodic block, means occasionally some beats are missing, some are not. Or you can say, instead of here, this is regular one. Suppose this is you have 2:1 means every time after 2 P wave, 1 QRS. This is here. But in this what happens? Suppose you have 6:5, 8:7 means 6 P wave followed by QRS. So this is Mobitz type 2 block. You can see here, this is 2:1, but this is not regular, periodic block. Okay. This is 6:5 means you can see you have 5 QRS and 6 P waves. Suppose if we are counting here, how many QRS? 1, 2, 3, 4. Okay. And how many P waves? 1, 2, 3, 4 and 5. So this is known as 5:4. Okay, this is periodic. not always regular, like this 2:1, 2:1. Okay, so this is Mobitz type 2 block. Then third degree heart block or complete AV nodal block. Here what happens? Ventricular rate that is slower than sinus rhythm. Okay, completely. You can see here always ventricle is not showing the rate of atria. So ventricular rate is 40 beats, around 40 to 42, because complete blockage between atria and ventricle. So atria depolarizes by its own, ventricle by its own, and ventricular rhythm is known as idioventricular rhythm. Idio means independently, ventricle starts generating its rhythm. Okay. Now ECG finding here, they are, the person is having atrioventricular dissociation, means atria generates its own P wave, ventricle generates its own QRS. Rate of rhythm of atria is, you can see 100 beats, but ventricle is only 40. No relation between P wave and QRS wave rhythm, QRS complex rhythm. Okay, so this is third degree heart block. Now, very important pathology here is Stock-Adams syndrome. What happens here? In Stock-Adams syndrome, as I told you, this is found in complete heart block, means atria generates its own rhythm, ventricle generates its own rhythm. But what happens after few seconds? Ventricle starts its rhythm, and this is known as ventricular escape. Okay, what is ventricular escape? Means ventricles, they generate their own rhythm. Okay, but what happens here? There is decrease in the blood pressure. Okay, sometimes what happens? Ventricles take some time to start the rhythm. If suppose it is more than few seconds, more than 1 to 2 minutes, what happens? Blood pressure falls. Okay, and brain is not getting proper blood, and if brain is not getting proper blood, then what happens? The person is having loss of consciousness. Okay, person is having convulsions, and person may die also, death. Okay, so these are the symptoms. Okay, fainting, fall down, syncopal attack is also there. Okay. Next is bundle branch block. What is this bundle branch block? You can see here either right or left bundle that is blocked. Okay, bundle of his is blocked. Okay. What happens here? Conduction, normally what happens? From SA node impulses, they pass to the AV node, AV bundle, then immediately it passes through bundle branches and it depolarizes the ventricle. Okay. But here, because of blockage of the bundle branch, suppose if you can see left bundle branch is blocked. What are the ECG changes here? Ventricular rate is normal. Okay. But the QRS complex is prolonged. You can see here. And this is in opposite direction in case of left bundle branch block. In V1, you can see like this. Abnormal ST segment and T wave, you can see here. This is ST segment and T. And second heart sound is pleated. Normally what happens? Normally right ventricle contracts after left ventricle. First left ventricle, then right ventricle. So what happens? Aortic, whenever we have discussed, second heart sound is due to closure of aortic and pulmonary valve. They are semilunar valve. So normally what happens? A2, P2 means you can see aortic valve closes, 2 means second heart sound, followed by pulmonary valve closure. So this is normal pattern because left ventricle contracts faster than right little bit. So we have splitting, but this splitting is more, the duration is more because left bundle branch is blocked. Okay. Then in right bundle branch block, what happens? Right bundle branch is blocked secondary to pulmonary disease. Here the person is having right axis deviation. We discussed yesterday about axis deviation. Normal axis is around 60 degree, and axis deviation, this side it is left axis, this side it is right axis deviation. So right axis deviation is found, and right ventricle contracts much later than left ventricle. So your this A2 P2 means splitting is more common in your right bundle branch block. Okay. Next is your ectopic cardiac rhythm, which is also known as ectopic beat. Here what happens? Any other focus, you can see here, not the SA node, AV node, bundle, no, nothing, but some other part, ectopic focus starts producing impulse. So this is known as ectopic cardiac rhythm. Okay. Now, this is again of two types, atrial and ventricular. If the beat focus is in atria, this is atrial arrhythmia. If it is in the ventricle, this is ventricular arrhythmia. This is, you can see, atrial arrhythmia because you can see this P wave followed by QRS. And ventricular, you can see, you won't find P wave when the impulse or ectopic focus is in the ventricle. Hmm? This is ventricular arrhythmia. Okay. New rhythm, maybe only single beat. So that is known as extrasystole. One premature beat is there. Only one beat is there. Premature. You can see here. There is only one beat. That is ectopic beat or premature beat. And what is the reason? There is some focus either in the atria or ventricle, and that is because of ischemia, decreased blood flow, small plaque is there, calcified plaque, or irritation of AV node that produces this extrasystole. Okay. If it is in the atria, this is known as atrial extrasystole. Okay. What are the clinical features you can see here? This is the atrial extrasystole. You will be having premature P wave. Okay. And you will be having followed by a short PR interval because it is premature. Okay. Then QRS complex and T wave, they are normal followed by. Okay. Another thing is cardiac rhythm is shifted and cardiac rhythm may be resetted. So you can see when next beat comes, this TP interval is long because premature beat discharges the SA node when and then it repolarizes and the fiber after normal interval when during this normal beat has come, your ventricle is in the refractory period. So this normal beat will not be found. So you can have longer TP. Okay. So this cardiac rhythm is shifted instead of, so suppose this is your premature beat. Okay. So after that, if your normal beat has come somewhere here, so what happens? This cannot produce the PQRS. So what happens? Now after that, it has to wait for the next normal beat. So you have long TP interval after atrial extrasystole. Okay, sometimes it is normally present, person may not aware of it also. Okay, and sometimes it may produce pulse deficit. Pulse deficit means heart rate is there but pulse is absent. Suppose the person is having extrasystole, then that beat is not, it will not produce pulse. So when you are measuring pulse rate and heart rate, suppose your heart rate is 82 per minute, you will be having pulse rate of 78 per minute. So you can say this 4R, you can say that these are extra beat. Okay, or you can say these are known as premature beats. Okay, then next is ventricular extrasystole, means some ectopic focus is there in the ventricle which generates its own rhythm. Now this is known as, very important question, PVC, premature ventricular contraction. Now what happens here in the ECG? P wave is absent. You can see here, this is after T wave, you don't have P wave. Okay, then you have QRS complex. Okay, and sometimes P wave of the next cycle that is buried within the abnormal ventricular complex. And very important thing here is T wave is inverted here, opposite direction to the QRS. If suppose QRS is this way, then T wave is like this. Okay, so these are the ECG appearance of ventricular extrasystole. Okay, what is the clinical significance of premature ventricular contraction? They are benign in effect. Sometimes excessive cigarette smoking also may produce, or excessive coffee consumption, lack of sleep also produces this kind of premature contraction. Emotional irritability also produces premature ventricular contraction. These are physiological causes. Okay? So these are not very much significant, but some of the premature ventricular contraction are because of impulses or signals from the infarction or ischemia. When it is because of infarction and ischemia, that may lead to fatal condition, that is life threatening. Okay, so premature ventricular contraction, they are life threatening. When they are life threatening? If they are there in the vulnerable period. Vulnerable period. Now, what is this vulnerable period? That is the period at the end of T wave. You can see here URS, you can see here, this is T in the opposite direction. So if it is at the end of T wave, if you have premature ventricular contraction, that may lead to death of the individual, because this is vulnerable period for causing atrial fibrillation. For causing fibrillation, not atrial, but causes fibrillation. We will discuss what is fibrillation. Okay. So this is the clinical significance of premature ventricular contraction and ECG changes. Okay? So this is all about today's topic. If you like my class, just press the like button. You can share with all your friends, and you can subscribe our channel Unacademy Future Doctors. Those who are watching me, I would like to tell them that my tomorrow's class is also on ECG cardiac arrhythmia. They are very important topics. So stay connected, attend the class live, and if you cannot, just you can watch the video later on also.